I'm Danielle Turnak. I'm an anesthesiologist and I'm fellowship trained in chronic pain management, and I run an interventional chronic pain clinic here at the hospital. I went to medical school at IU. I did a fellowship at IU and a residency at IU, but I did my internship out at University of Connecticut. So my residency was in anesthesia and my fellowship was in chronic pain management. I was always very good with sciences and I always had an interest in medicine, and I was encouraged to do that at probably a fairly young age, and it was just something I really enjoyed reading about, listening about, things of that nature, and so it just kind of progressed from there. I had an undergrad degree in neurobiology, and that just kind of morphed into going to medical school. Chronic pain management is the study of trying to get people to feel better with their chronic pain, which is usually something that occurs usually about 3 months out that is not resolved. Everybody can have some pains that come and go, but pain that stays around usually longer than 3 months is deemed chronic, and it's a specialty to try to make that better. We use a balanced approach here, so with it we try to use multiple modalities. We use physical therapy, compounding cream, bracing, adjunctive medications, narcotics, and mainly injections with steroids or local anesthetics to try and decrease people's pain, get them back to functioning better, feeling better, and being able to do what they would like to do. We are a referral clinic, so either a referral from a specialty, whether it's surgical, neurosurgical, neurology, or from their primary care provider. A good candidate would be someone their pain is not resolving after conservative treatment with their primary care providers or their specialties, whether or not it's some of the things that we do or some of the things that they've done, rest, non-steroid analgesics, heat and ice, and it just continues. And those are probably the people that we would look at and see if we can do something to help them. A new patient visit, we always go over their past medical history, medicines, surgeries, and things of that nature, as well as any studies they've had, any other things they have done for their pain, try to evolve it into a good picture of what's going on. Pain is not an exact science. We can't do a blood pressure and get a blood pressure reading, or a blood sugar and get a blood sugar reading to know exactly what's going on with diabetes or high blood pressure. We have to listen to the story, do an exam, listen to all the different pieces of studies they've had in the past, come together and try to form a good plan going forward. Unfortunately, pain management is very individualistic in that every person runs a different path, a different course of action, a different course of treatment. My approach to pain management is to try to get people better through multiple modalities. The hospital is backing that and want us to try and get patients better. We are glad to offer this service for a smaller hospital so people do not have to go to Indianapolis or Terre Haute in order to try and get these services. I think the most rewarding thing with pain management, when you get someone out of pain or reduce their pain so much that they come in with smiles and tell you that they're able to play with their grandchildren, or they're able to do the activities they used to do, or they're going back to work. And all that really keeps you wanting to get more people better.